determinants of health are the conditions in which people are born, grow, live, work, and age. These factors include socioeconomic status, access to education, your neighborhood and physical environment, your employment, and the access you have to strong social support networks and quality healthcare. My name is Nancy Quiroz-Gomez, and I am a nurse educator at St. Peter's University Hospital. Today, I'll be speaking with Ishani Ved, Director of Transformational Population Health at St. Peter's Healthcare System. We'll be diving into our social determinants of health and how our community was affected by COVID in a variety of ways. We'll also be speaking about St. Peter's newly expanded Family Health Center. Ishani, thank you for joining St. Peter's Better for Life podcast. How are you today?
Great. How are you, Nancy?
I'm doing well, thank you. I've heard you're doing some wonderful things over at the Family Health Center. Would you please tell us a little bit about the St. Peter's Family Health Center?
Located in New Brunswick, St. Peter's Family Health Center provides care to pediatric and adult patients, along with reproductive care for women. People can find care such as routine appointments with physicians or even behavioral support and access to community resources.
So that's good to hear. I'm glad you were able to let the community know what is available. Can you please let us know how we serve people regardless of their background or socioeconomic status over at the Family Health Center?
Middlesex County is one of the most diverse counties in the country, and we are lucky to be able to serve this diverse group of patients. St. Peter's, through participation in the Community Health Needs Assessment and the Community Health Improvement Project, has aligned itself with the needs of our patients that extend beyond the four walls of our hospital. So we know that 60% of health outcomes have more to do with our individual behaviors and our environment than healthcare itself, which only represents 10% of the overall health outcomes. St. Peter's, through its Catholic mission and through the fabric of who we are, serves patients regardless of their background or socioeconomic status, where they live, their religion, the way they eat, any of that. So we take great pride in the fact that we're able to serve all of our patients and tailor their care as much as we can by knowing about where they come from and who they are.
Okay, thank you for that. And can you tell us, or can you explain to the community a little bit of what is the meaning of a social determinant of health? That way we could kind of bring it in with how the Family Health Center is working towards improving those social determinants of health.
Social determinants of health, put simply, are those factors that will impact your overall health outcome but have more to do with your day-to-day life. Things like, were you able to get a higher education? Were you able to find stable employment so that you can support your family? Whether or not you have family and friends around you to support you through the trials and tribulations of life, and whether you have access to quality health care. And the things that can affect access that we're very cognizant of are access to transportation and access to insurance. So there's a lot that's done during a patient's visit to make sure that if they have trouble finding a ride, that we help them address that, and we help patients apply for charity care and Medicaid so that they can maximize their healthcare benefits.
Okay. Now, which determinants would you say are the most common that we see here in New Brunswick or the Middlesex County area?
Yeah, so our top two are lack of social support, which is very broad of a term, but again, that goes back to whether or not you have folks that are able to support you in your day-to-day life, whether it be taking care of your kids when you go to work or to help you get groceries if you're homebound. So social support is very, very important, and it's one of the top reported social determinants of health. Some of our patients might have also moved here from a different country, so immigrant families tend to have that experience in the first few years finding their way. And the other one is lack of insurance. So there are things that we can do to help our patients get insurance. Aside from that, we do see, which is related to the first two, financial insecurity and food insecurity, which is something we're super, super passionate about here at St. Peter's, and we have initiatives underway to address food insecurity, but we know that lack of stable employment will have a ripple effect on your life, so that could affect your housing and your food.
So we see that St. Peter's is focusing on addressing these social determinants of health, especially through the Family Health Center, not only through the main hospital. And I was informed that you have a food program, or I'm not saying it correctly, but can you tell me the correct term for it and let the community know what your program is and what you're working on?
The market at St. Peter's is set to open in April, and we're super excited about that. So last summer, our team, our social determinants of health team at the Family Health Center, established a food market for our patients, and we are operating out of the Family Health Center. We've been blessed with a new space through grant funding that will allow us to have a better experience for our patients when they come to shop. So our key tenets for this program are the client choice model, so empowering our patients to choose what they take home from the market, and also pairing them with a nutritionist so that they can have a one-on-one counseling session based on whatever diseases they might have, and choose foods that are more appropriate, or choose foods that are culturally relevant to them, and tailoring those recipes that we give out in tandem with that food to food that they're used to eating, or making incremental changes, because it can be tough to adapt your way of eating to a new location or a new cuisine. So we're trying to make that as easy of a transition as possible. But also, we've noticed that there is a need for non-food supplies as well. So we do offer our patients with the highest need access to things like diapers and formula and other non-food goods. And we get so many donations. We're so lucky to have wonderful community partners and donors that make it possible for us to make those items available in the market.
And I'm glad that we're having this conversation, because just as we could see how our community's working, right? How just in general, economically speaking, everything's just so expensive, right?
Right.
And one of the social determinants of health would also include the finances, like you said. If a parent isn't working, it may just make it harder to have a regular meal, not to say regular diet, but just a meal at home. And then having an unhealthy diet can lead to medical issues. And it all works, it's like a ripple effect, right? So one thing happens and everything snowballs, like also called what I would say a snowball effect. But if we look at even fast food options, what used to be like $1 menu, nothing's $1 anymore. Now you're spending $5-6 for something where you could possibly buy something healthier, just have a healthier option, right? Or even, I have nieces and nephews, so they love Wendy's, so you go in 4 for $4, but you're not making these healthy options. And sometimes it's just what's at my reach, like what can I afford, versus $1 for a hamburger that I may be full a little longer, or spending $4 for, let's say, like an apple or 2 apples or cucumber, tomatoes, like everything's expensive. So, and I say that to bring a little more attention to the market, right? So how does someone get access to the market? Do they have to be an existing patient at the Family Health Center? They have to meet a certain criteria, correct? It's not like I could just walk in and say, I'm hungry.
Right. So what sets the market at St. Peter's apart from the other food pantries in New Brunswick and Middlesex County? There are over 160 in Middlesex County, and that's a staggering number. Middlesex County has a county food bank, which was formerly called McFoods. It's now called Replenish. So they are one of a kind, actually, in the state to convene all of the food pantries in our area, and to make sure that if we have excess of one item, that we share with those other areas that might not have that. So it's a really contained effort. The thing that sets us apart from other food pantries, what I was saying, is that we have a nutritionist that will meet with that patient. That's not something that you get in every single pantry.
Correct.
So
Yes.
the way you get on to our list is by being screened by the Family Health Center Social Determinants of Health team during a routine visit or a
Okay.
follow-up visit. So we identify patients that are most likely to need supportive services, and we screen them and ask some more questions by sitting down, looking them in the eye, face to face, speaking their language. If they speak Spanish, we speak Spanish too, so that's very, very important for us. And then once we have that information, we put them on a list to be a part of the program. And it's not that we want our patients to stay in the market for months and months and years. We want to equip them with the tools so that they won't need us anymore and that they make the most of that time with us. So getting that financial security education, helping them get housing if they need it. There are so many services in Middlesex County that our patients can avail of, but they might not know that they exist.
No, and you're absolutely right. I'm learning this now through my position as a nurse educator. I'm part of a COVID-19 grant, so I spend most of my time out in the community and having that one-on-one conversation with the community, right? I've learned all these, I've learned what they want, what they need, what they're missing, but working through the hospital, I've learned what opportunities we have to offer that they are not aware of.
Right.
So I love the fact that we're able to have this conversation, bring this information out into the community. But let me ask you, since I've seen how COVID has affected the community, what impact have you noticed, if at all, with COVID or long COVID in our community? Or how can you relate that to, I guess, the social determinants of health, right? What have you noticed?
Yes. Very timely as we reach the 4-year mark, which is hard to believe, from the beginning of the pandemic. The data shows, and we've seen this firsthand, that families that were affected by COVID-19 experienced higher levels of unemployment and just life-changing situations due to that illness. So in the beginning of the pandemic, more folks were getting seriously ill and dying. So if the head of the household or whomever is bringing in the income can't go to work, or unfortunately passes away, that will change the lives of their entire family for the coming months and years. So we saw that happening, and again, we keep coming back to this. It's a ripple effect. So people were unable to pay their bills on time. You can be kicked out of housing, right, if you don't have a rent payment.
No, of course. And then, like, going back to the diet, then it just leads us into not being able
Right.
to afford food and,
Right.
and clothing and putting our health at risk. So, yeah, it
Right.
kind of all works together, right?
Yeah.
So, sorry, go ahead.
It's tough decisions that need to be made.
Right.
And, as a nurse, you can see that. And folks who are parents can relate to the fact that if you have a limited income, you're going to make sure your kids eat. And if your baby needs formula, your baby's going to get formula. And often you see parents putting themselves last out of just being in a bad situation. So in a very real sense, we saw that happening. So anything that we can do to help lessen the effects of that or the long-term effects of that, we're trying to do. So if you can save $30 to $50 on your groceries, that might be the $30 or $50 you might need to pay for your medications. And we speak to physicians all the time. People are making tough decisions about, hey, I have 4 medications I need to take. I'm going to take the one that I can afford, even if it's not the most important one for my condition. So I'm sure you can relate to that as a nurse.
Absolutely. And one thing that I've noticed, especially with the Family Health Care Center, they have programs such as the Vaccine for Children program and the 317 for adult programs. Those are vaccination programs that still allow the community to receive federally funded vaccines. So that's also another service that I find. And the COVID-19 vaccine also falls under that service, which I'm really happy about because we're still trying to assist the community in receiving those vaccines, because even after reaching almost that 4-year mark, like you were saying, there's still a significant amount of data showing that the community still hasn't fully been vaccinated, even, or maybe just one, or there's a lot of people even now that I encounter in the community that their last vaccine was in 2021. So then our hospitalization rates may increase due to COVID, and it's the season, all these viruses are coming out, right? But so again, all of this seems to contribute to these social determinants of health, right? So now that you have this program that's pretty much up and running, right? Because you started it last year, but it's officially, or how does that work? You started it last year or this year?
We're expanding it this year.
Okay.
So with the addition of our nutritionist and our new space, we're excited to open our doors and open ourselves up to more patients. And to be able to serve more patients is one of our goals, starting in late April and May.
Nice. That's great. I'm loving the fact that we're pretty much almost there. Time flew, right? From the moment you started to now, almost April, May, we're pretty much there.
Yes.
Right, in the blink of an eye.
And, it's gratifying work. It's very important work. This is data that historically hasn't really been collected about patients. And if you have a limited time with your provider, you might not even bring these things up. So you might talk about your health issues, but that's a very key component, right? If you don't have a refrigerator or you live in a home with more folks, you might be more likely to catch a contagious illness. And so we saw that, right?
Yes.
In the height of the COVID pandemic. So the more that we talk about those things more proactively, and that's what we're trying to do, is to bring that into the conversation, spur those conversations earlier on so that we're not waiting for a missed appointment or an illness or an inpatient stay to address
these issues.
It's at the heart of population health.
Right. How are you seeing policymakers address social determinants of health to improve overall outcomes, or not just post-COVID, but I mean just in general, or if you see it at all, right?
Yes, I've been in population health for a long time. When we were studying this at Rutgers years and years ago, we talked about the same issues, but the difference today versus, let's say, 15 years ago is that we have more funding available today than we ever had. And we're happy to see that the White House has committed itself to innovative programs like ours, which is using food as medicine. And so the ripple effects of that have been, our state has aligned itself with the national effort to recognize that food is at the basis of our health, and food brings people together. So we see that. And we see more grants from private funders as well, in line with national and state focuses that will make it possible for more programming to come online. So a lot of this work is innovative, and there's not a lot of hospitals that are doing what we're doing. So it's exciting to be able to do something in this space. And we wouldn't be able to do it without our community partners around the state that have offered their help and their guidance.
And correct me if I'm wrong, but demographically speaking, I guess this Middlesex County is sort of a melting pot, correct? It's not just one, like one ethnicity, right? We have an array of cultures here that now we can provide each culture, like a culture appropriate meal, like you said, nutrition and guidance at the Family Health Center with the program that you started. Like, how proud are you? Like, and if you're not, I mean, I'm sure you are, but if you're not, like, that's amazing.
Yeah.
Because not many people could say, I did this. Like, I helped in this. This was creative. We did it. Like, it's amazing to see that's happening. Like, you're open to, I'm sure, I think you and I had spoke briefly or previously before. You said you were open to other donors, like anyone that has other food pantries or willing to donate any products, any items to the market?
Yes.
You're open to that?
We are very much open to that. And we are accepting donations in good faith. We now have the capacity to have a refrigerator, so we can accept refrigerated items and hygiene-related items, top of our list.
So what are you hopeful in the future regarding how St. Peter's can better address social determinants of health? Or what are you hopeful for?
As we speak more about social determinants of health, I am amazed at how people connect to the idea that a lot of our health outcomes go back to our lifestyle and our environmental choices. So I think just by talking about it and the house-wide education that we've done, the conversations that we've had, the implicit bias conference that we hold, and the various avenues where we discuss these topics has just raised awareness. And I think if anything that we could do, if we just raise awareness of noticing social determinants of health, it naturally trickles down to patients because we're more mindful in the moment about how is this patient going to live when they go home. So that's been very, very fruitful, and we continue to collect more and more data. We're always looking at it from 30,000 feet to say, hey, is what we see in big publications replicated here in our patients, and what are the real changes that we can make so that our patients feel safe accessing those resources and that somebody's on the phone with them when they try to access those resources.
Thank you so much. Again, Ishani, thank you so much for being a guest on our podcast. It was wonderful to speak with you and to learn more about these factors that affect our health, even when we might not even know about it. To our audience, we hope you learned something new with this episode that you can take with you as you think about your own personal health or even the health of your family members. Thanks for listening.